Could hyperbaric oxygen support people with autoimmune diseases? While autoimmune diseases are not technically on-label diseases that are treated with hyperbaric medicine, we do utilize hyperbaric oxygen off-label to help patients and support them through this autoimmune journey. When we're dealing with off-label indications in hyperbaric, we really have to look at the mechanisms of action of the therapy that we're utilizing. How does this device work and what will it do to somebody? And then the pathophysiology of this person's condition. Does it make sense to apply this therapy with these mechanisms for this condition with this physiology? And so if we did that and we assessed autoimmunity as a whole, what would we find? We would find that there are certain cytokines or inflammatory markers that are consistently and chronically elevated in the overwhelming majority of these patients. And one of the mechanisms of action of hyperbaric is to reduce inflammation. We would also see that there's cell damage and tissue damage in a lot of these cases. As a result of the chronic inflammation and the immune system attacking those cells become damaged over time. We know that one of the mechanisms of action of hyperbaric is cellular repair and cellular regeneration. There are a variety of different growth factors and repair factors that are released inside of our body as a result of repetitive exposures to hyperbaric oxygen. Therefore, from a cell and tissue repair standpoint, hyperbaric would also be reasonable to use in those cases. And lastly, there is this imbalance inside of the immune system. There is an overactive portion of the immune system, or in some cases, there's an overactive portion of the immune system, but then other areas of the immune system have been chronically suppressed through other treatments. So one of the other mechanisms of action of hyperbaric is balancing and regulation of the immune system. And so again, hyperbaric used to help create that balance inside of our immune system would be appropriate and reasonable in these autoimmune cases.